morning, everybody, and welcome. Thank you for joining today. I think let's begin our session now. First of all, I would like to welcome our HOD, Dr. D. D. Mankleshwaran sir, Professor and HOD, Department of Social Work, Bharathidasan University, and Dr. P. Ilango, Professor and Department of Social Work in Bharathidasan University, and Dr. D. Nirmala, Dr. Jerida Nyanajana Eljo ma'am, Dr. N. Rajavil sir, Karthik sir, and Suresh sir, Saloni sir. Welcome everybody. And our chief guest, Dr. Xavier Vinayraj. Welcome sir. And next, the students, first and second MSW students, and finally the virtual participants. Thank you so much for joining, and welcome you all. And next, we will move on to introducing our guest. Today we are presenting counseling skills for social work with a special reference to pandemic period, presented by Dr. Xavier Vinayraj, Assistant Professor in DePaul Institute of Science and Technology, Angamali, Kerala, and he get PhD in 2018 at Bharathidasan University, and he is lifetime member in Indian Society of Professional Social Work and Indian Council of Social Welfare, and also a member in Kerala Councillors Forum. And he published several articles about mental health, sexual education, etc. And also he presented around 15 papers in state, national, and international conferences. And he also participated in international fieldwork education program in James Cook University, Townsville, Australia, and completed mental health first aid course in Center Care, Australia. Also, he attended international conference on unity in diversity at Australia, and he also very experienced in mental health and counseling. So let's move on to our presidential address. I would like to welcome Dr. D. Nirmala, Assistant Professor, Department of Social Work in Bharathidasan University. Welcome, ma'am.
Okay. Very pleasant morning to all. Today's webinar on counseling skills for social workers with a special reference to pandemic is going to be very much useful and informative for the participants. Counseling is very much a powerful instrument. It is much significant in bringing changes in the lives of the individuals, groups, and communities. And it also helps people to navigate from the difficult situations they face in their life. And when social work, a very catchy meaning, we say that helping people to help themselves. Social work is helping people to help themselves. Likewise, counseling is also rooted in the principle that individuals can help themselves, provided that they receive the right kind of support. So this counseling provides the right kind of support through the professional social workers. And this, especially with this pandemic disease, COVID-19, has shaken the entire world. So the social workers must be aware that how far counseling can be provided during this particular scenario. So this webinar is mainly focusing on the counseling skills, what the social workers must be aware of, and how it can be applied, practiced in the field during this situation. And so that through this session also, the participants can come to know where we stand, where we social workers stand with regard to counseling, and with regard to this pandemic disease. And it will be much useful for the participants, because mainly the entire focus is with regard to this pandemic situation alone. Students would have learned about counseling, they would have studied the counseling, but this session will be giving you inputs with regard to this COVID situation. Through this program, I expect the participants to get a benefit out of it. And the resource person also, a highly resourceful person, whom we have today, Dr. Vinay. He is our student, awarded PhD at our department, did his PhD under the guidance of Dr. Jeridan Yanajin. So with his inputs, this program will be highly informative. So with these few words, I hand over the session to Ms. Sangeetha. Thank you.
Thank you, ma'am. So let's begin our session, sir. Dr. Xavier Vinayraj, sir. I'll hand over this to you. Thank you,
Yeah,
sir.
thank you. So I am very happy to take a session in Bharatiya University because I can proudly say that there is a important part to molding me as a social worker. Uh, the social work department of Bharatiya has great role because I was working there. Sorry, I was doing my PhD in Bharatiya University, and Dr. Jerida, Dr. Nirmala, Dr. Ilango, Dr. Mangaleshwaran, and all my gurus, they were helping me in different ways to molding me as a professional social worker. So I am very privileged to come again, even though it is virtually. So that makes a difference. Even in current scenario, we have to adapt with our situations. So as a social worker, we have to always adapt to the situations. Anyway, with the permission of all my gurus over there in Bharatiya University, let me begin this session. So we will be dealing about counseling. Hope I think you can see. Yeah. So in this session, I have planned to discuss uh, some points. One, we will be just discussing what is counseling. I understand that among the participants, there are some students with BSW, some students started their MSW. So even though many other people are there, they know all the knowledge about counseling, but we will just go through with a limited time. So what is counseling and all. Then important major part, skills needed for counseling. Then, when we deal with the skills, present needs in counseling. So, current COVID scenario, what are the special needs we have to focus? What are the special skills we have to give more stress, more important? Then we will be going to adapting to the unexpected and unexperienced situation. As we know, Corona is unexpected situation for every one of us. In our lifetime, we never had this experience. Then, since we don't have experience, we have to learn, we have to adapt to the situation, then we have to find out solution. Then we will be dealing with identifying opportunities. So as a social worker, we have plenty of opportunities, n number of opportunities in counseling session. So since we have more opportunity in counseling, like school counseling, adult counseling, marriage counseling, all those things, family counseling. So we have to adapt with the situation. So identifying opportunities. Then we will be dealing with what are the demands, current demands and possibilities. So without going through definition of health, we cannot go to counseling. We cannot explain how a social worker can deal with skills in counseling. Because as WHO definition says, health is a state of complete. That word is very important because it's a complete physical, mental, and social well-being. So some people may say health is physical. Earlier it was like that. They were thinking if we don't have any diseases, we will be healthy. So now we have to physically healthy, mentally healthy, and socially healthy. So when we're dealing with corona, we should be physically healthy, we should be mentally healthy, we should be socially healthy because corona affected all these aspects. So not only the absence of diseases, but we have to make a complete physical, mental, and social well-being. So just before I start, I would like to share one of my experience. So one of my student in my previous college, one day she called me and told me that if, sir, I have COVID positive. Then I was speaking to her. She was telling all these things. So physical issues. So she was sharing what all the physical issues she was going through. She don't know from where she was affected corona. But when the symptoms are shown, she went and the medical report came as COVID positive. So physical issues she was going through. Even though before COVID was affecting, she was fearing about corona. But when it is affected, she was physically feeling the problems of corona, and she was telling all the symptoms of coronavirus affected her physical body. Then she was telling me mental problems because since it is affected and since it is COVID positive, she has to stay in isolation because keeping away from other people in order to protect them from affecting corona. So the mental situation she was facing during the situation she was explaining. So as a counselor, as a social worker, we have to understand what are the physical problems people face during corona situation before affecting and after affecting and during affecting. So before affecting they have fear, they have to keep up the regulations of WHO or IMA in order to protect them from corona. So physical issues before, during and after. Before we give counseling, we have to know what are the physical issues related with the coronavirus. Second thing is that mental. So mental means how these people will be going through this isolation time. Sometimes people may have to stay 8 days. Sometimes it is 10 days. In each place it is different. Then another thing is that when we are primary contact, secondary contact, we have to go for quarantine. So that time also we will be sitting in isolation. So we will be going through these mental issues. So as a counselor, as a social worker, we have to understand what are the issues these people facing. Then third one is socially. Socially means since we are going for quarantine or we are going for treatment, sometimes we may go to FLTs, sometimes we may stay in home. Current scenario, we will be staying in home and we will be keeping away from other people. So when we are COVID positive, the student was telling, sir, the major problem I was facing was stigma. Stigma means social stigma because people were staring at them, people were keeping away from them, and the social relationship people was showing towards them. That was most painful for her. So she was telling that physical, I was suffering. Mentally, isolation, I was able to manage. But this after and during this corona, the social relationship was most painful. Then emotionally, because of social distancing, attitude of others also we have to face. So case one was that she was facing first time in life physical issues. She overcome through medication. Mental issues she was able to manage by making a counseling. Then social issues she was managed by herself, but other people, that relationship that she has to it will take time to make it okay. So we will come to our theoretical part. Who is counselor? So in order to understand all those things, in order to help a person during this corona situation, we have to understand who is a counselor and all those things. So I'll be just going through all those things. So first we will be dealing who is counselor. A counselor helps his client to recognize their problem, analyze it fully, and also assist them in facing the problem and handling them effectively. So we can understand from this. A counselor is helper. Whom he is helping the client. For what he or she is helping, recognize their problem. Then not only recognize their problem, the counselor will help them to analyze it fully. So first they will recognizing the problem, then that problem they will be analyzing, and they will be assisting this client to facing the problem and handling them effectively. That is a part of the counselor. So we know professionally trained person is a counselor. It can be paid service or volunteer service. In Kerala and many part of India, current scenario, many people are doing voluntary service for providing counseling. When and who needs counseling. So earlier counseling means people go for counseling out of need. When they have some need, they will be going for counseling, or they have some wants, then they will go for counseling. It can be difficulty to function their daily lives. Some people may have difficulty in their, if they are studying, some study problems, learning problems. If they are working, some stress, depression, anxiety, all those things in the work life. Some people may have family problems like marital problems. All those things people will go for counseling. When feeling stuck, some people feel that they are not nowhere, they are in an island. They started from some place, in between they are stuck, so they have to go forward. In that situation they will be seeking counseling. Difficulty in decision making. So some people is not able to make a decision whether I have to say yes or whether I have to say no, whether I have to choose that or whether I have to reject that. So when decision making is difficulty, people will come to counselor and they will be getting professional support. So another one is to develop skills. So some, as I was telling, that some students may not have proper life skills, then they will come for different skills practice with the counselor. Then some people will be coming for not able to overcome depression. Already we have seen in the above, depression, stress, anxiety, all those things. Then some people will come for counseling in order to answer this question: who am I? Some people may struck, we have seen the above, who am I, why I am here, am I on right track? So some identity crisis, people may have some identity crisis, then they will be coming for counseling. Why do my relationship fail? Some people may have relationship issues, social issues, so they will come for counseling. How can I handle my worry? Some people may always worrying, or some stress, depression, anxiety, then they will come for counseling. Simply to understand them deeply. Some people may come for understand. So during this corona situation, we are worried about these situations. Many people. So lockdown time, we were worried about lockdown, self-isolation, COVID positive, quarantine, first line treatment center, unlock phase 1 to 5, social distancing, masks, washing hands, then coronavirus immunity. So we know immunity is one of the major factor for affecting our corona, and for even death also. Then incubation period, outbreak, all those words were, when we were hearing in the newspaper, in the television, these words were making us fearful, stressful, and frightened. So social distancing, then symptomatic. Later, when medical team was able to develop more about corona, then they said some people have symptomatic corona affecting, some people have asymptomatic corona. So as a counselor, we have to know these things, and because people may have fear, ventilator, confirmed case, test positivity rate, route map. So some people were feared about route map. In earlier stages, when a person was affected with the corona, these route map were making. So many of us are undergoing, or our client seeks our professional support for fear, physical issues, economical issues, social issues, anxiety, stress, etc. So what is counseling? Counseling means process that enables a person to sort out issues and reach decision affecting their life. So something affecting their life, they will come for counseling. So counseling involves talking with a person in a way that helps that person solve a problem, or help to create condition that will cause the person to understand, improve his behavior. So sometimes maybe for their behavior modification, sometimes for character modification, sometimes about value system, sometimes because of their life system, counseling will be helpful. So this is the definition, the same thing I was telling in previous slides. From this definition, we can see that I will be just going through one only. It is a process in which the counselor assists the counselee to make interpretations of facts. So what is affecting them, that fact they will be interpreting, relating to choice, plan, or adjustment. So by interpreting the so because everything he knows, but he or she, the client knows, but sometimes mind will be stuck, so they need help. Then this interpretation of the fact will be helpful for choosing choices or adjustment which needs to make. That is Smith definition. We have same way Pepinski definition, Carl Rogers definition, Frederick Perl's definition. I will be sharing this slide if you want. And many of us know, so already when we studied this counseling, we have studied these definitions also. So counseling is non-judgment. So when we are doing, we have studied when we are doing counseling, it is non-judgmental. It is understanding to help you make a sense of what is happening in your life. So understanding is given to the counselor. Counseling is getting from counselor what is happening in their life. Then listening is one of the important skill a counselor has to, because through proper listening only we will be able to understand the problem. Then responsive to individual needs. So the counselor will be responsive to individual needs. So people come for different needs. So counselor will be understanding that needs and they will be supporting to solve that needs. Then changing we have seen through counseling, the counselor will get change in their life. Sometimes it may be behavior change, sometimes behavior modification, all those things. And basically, and very importantly, we have to be confidential as a professional social worker. Then principles. The first principle is important. The client knows what is best for him. So we shall not give advice. We shall not. So the counselor will be giving just what is happening in their life. They will be throwing a light on that. So by getting light on their life, they will be able to take choice. So client knows what is best for him. Interpretation by the counselor is likely to be inaccurate and is best avoided. And we have to always avoid unwanted judgment and all. So we have to give them interpretations, but that will be taken best by the client. Advice is rarely helpful. That is one of the important principle. Counseling is not advice. So different personal words of client and counselor. So both people have different words. According to their own words, they will have their own style. Listening is the basis of counseling relationship. So most important is listening. So how we are able to listen the client, the counseling will be effective, more effective. So we have to listen everything. So their voice, the modulation of their voice. So through that modulation of voice, we can understand what is happening in there. So we will be more than listening, we will be listening their body language, everything. So counseling techniques should not be overused. So we have to prejudgment. We have to use according to the need and purpose. Counseling can be learned. That is one of the important thing. Everyone, as a social worker, in the beginning stage, you may not be able to give proper explanation, but gradually, when you are doing more counseling, more experience, you will be learning to support them more effectively. Then goals of counseling: improve individual's total functioning, to maintain the client's adaptive pattern, to modify maladaptive patterns, personality reorganization, resolution of problems, improving personal effectiveness, decision making as a goal, facilitating behavioral change, improving relationship, enhancing coping skill, facilitating client's potential. So all those things we have explained in previous slides. So these are our goals in overall. So counseling aims to help each individual take charge of his or her own life by developing the ability to make a wise and realistic decision. So decision making is one of the important. What they have to choose, what plan they have to take, how we have to implement. We will be coming to that things next slides. Altering their own behavior to produce desirable consequence, providing information. Counseling is expressing your thoughts and feelings with someone who can help you make sense of things. So we were telling listening is important because when the counseling is more open, more expressing, then only we can listen more and we can understand more. Then only we can give them more light on their life. Counseling is different from other ways of helping, like not giving advice that people knows. The counselor and client play an equal role. So in counseling, both has important role, because when the counselor is able to open, then we can understand the real problem. And when the counselor is able to give trust and rapport, then the client will be able to open up. So equal role both of them have. It is a mutual understanding and mutual supporting. So counselor assists people to better understand themselves by explaining options. So the counselor, after listening, after understanding, they will explain the options, what all the options are there. Then they will explain some goals and helping them to take action. So basically, the counselor will be taking decision. We will be helping them to show the options. Then, if you are doing counseling, what are the results? So, people will be more confident, more relaxed, more healthy, less lonely, more in control, less anxious, less stressed, less angry. So, you have to observe these things carefully, because these things has great role in deciding our skills. So our skills should be there for these things. So in order to make them more confident, we need skills. In order to make them more relaxed, we need skill. In order to make them more healthy, we have to give them some knowledge and we have to support them properly. In order to have more in control by counseling, we have to make them understand what is happening in their life. So we need listening skill, we need observation skill, we need communication skill, all those things. So these are some problems normally people come for counseling. Then this is one of the important, we can remember gather. Gather is the steps for stage counseling. First one is making rapport building, that we can say as a G. Greet client in a friendly, helpful and respectful manner. Ask client about needs, concerns and previous use. Tell client about different options and methods. Help client to make decision about choice of method she prefers. Explain to client how to use the method. So gather. So this tells how we are starting a counseling session and how we are ending a counseling session. So we will be having rapport. We will be listening them. We will be giving narrations or options, and they will make a decision. They will make a choice, and they will implement it. So we will be yeah. Hello. Hello. Is it okay?
Yes,
Yes, sir.
Vinay.
Yeah.
Proceed.
Yeah. So these are same thing. We are making a circle of decision making. First, we will be making rapport. Then we will be data gathering. Then we will be determining the goals. So we need skills for all those things. The main thing is establishing rapport. For that, we need skill. So if we are thinking about current scenario, we will be discussing it later part. So we need a skill for rapport. We'll skill for data gathering. So when they are telling, we need empathetic approach. We need listening skill. Then only we can collect data from from the client. Sometimes we have the data from other people related to the client. So we have to get maximum data from maximum people. That will be helpful for us to determine the goals. Then generating alternative solutions and generalizing. So stages of counseling, same thing. First one is developing a relationship. Since you know these things more, that's why I'm running fast. If you are not able to follow, you can stop me. I will be go slowly. Is it okay? Are you able to follow me?
Yes, sir. Yes, sir.
Okay, fine. Okay. So first one is stages of counseling, developing a relationship. Second one is making an informed assessment. So after relationship, they will be making informed assessment. Then establishing mutual agreed upon goals and objectives, implementation plan, termination, and follow-up. So this developing relationship, then questions to consider when trying to develop a relationship. So when we are making a relationship, what ways can you build better relationship with the client? So we have to think. Each counselor has to think. As a beginners of social work, you have to think. What are the ways you can make better relationship with the client? How you can make a rapport? how you can win the trust of that people, how you can win confidentiality from that person, how we can make a better communication. So what are the questions we have to ask? If a client is resistant, what steps can you take to reduce resistance? Sometimes a counselee maybe came for forceful from other persons. Sometimes family members will be asking them to come and attend the counseling. Then initial stage they will be resistant. So I can tell one experience. There was one client. He was addicted with alcohol, and he was all whenever he is consuming alcohol. When sees some particular persons, he will get irritated and he will be making all the misuse with not only with that person, with everyone coming in front of them. Sometimes these irritative people are not there. That person is very good person, even if he is consuming alcohol. So when family members send him for counseling, initially he was telling me, why I need counseling. I don't want counseling. I know what I am, and I know what is happening in me, and I am able to control myself. Why I need counseling? So when we started sessions, when we start able to make a rapport, I was telling him, I am not to make any forceful judgment, or I am not making any counseling. If you don't want counseling, we will not make a counseling. Counseling. Then I asked him. I started him. Do you know what is counseling? Then in that way we have started a talking, like friendly talking, and gradually we were turning back to counseling without understanding it. So we have to understand why this person is resistant and how we can remove resistance, because we have to make them good rapport, then we will be able to make the resistance. So one of the important skill is rapport building. When we are making rapport only, people will be able to start talking to us, and people will be start opening us. If they are not opening us, it is difficult. In current scenario, some place only direct counseling is happening. In 90% place, it is happening online only. So online has its own difficulty. See, in sometimes we will be only having teleconference. Some cases only we will be having video conference. Those who are having facilities only, we are having video conferencing. So video conferencing, we can see only their face. So from face, we have to understand their body language. Face-to-face counseling means we can understand whether what they are telling is true from their body language. So when a client is resistant, we have to understand what we can do to reduce resistance. After reducing resistance only, we can start our sessions. So rapport building is not an easy thing in some cases. So how do you know when you have built a solid relationship with a client? So a counselor should understand whether counselor has built a solid relationship with the counselee. Then we can go ahead. Before that, we have to make a good rapport. So later we will be making informed assessment. So whenever we are doing anything and everything, we have to do everything informed. So first step in making assessment is to find out change is necessary. So we have to ask them why you are here. What is your, so we have to understand what change they are expecting. Whether it is a behavior problem, whether it is a family problem. So then only we can start assessing the problems. And if it is, then next step is to figure out what needs to change. If it is change, then we have to understand what change, behavior or attitude, anything and everything. Okay. So good assessment can provide an opportunity for young person to see how his behavior or attitude might be contributing to an undesirable unhealthy. So this says what is the desirable needs. Then assessment is an ongoing process. So we will be doing assessment. Then we will be see how things are going. We will be regularly checking. Then if needed, we will be doing reassessment, whether it is going well or doing it as we planned. So we can gather information in different ways. We can gather information from the client, we can from their family members or people related to that problem, or persons related to that person. So we can collect through direct conversation and other means we can also collect. So when we are doing assessment, we have to be aware of your biases. So we cannot go directly to the judgment. So we have to avoid biases. Then involve clients. So major and always we have to remember that the success of the counseling is based on how much we are able to involve the client. So that we need skill. So sometimes some people will be simply giving advice. So not giving advice, we have to maximum we have to make sure that the client is involving, client is speaking, and client is taking decision. So then when assessment also we have to understand the same principle. So gather as much as information as you can. Don't automatically label a behavior or dysfunction. So when we are seeing or hearing itself, cannot judge this is dysfunction, so and so. So we have to collect a maximum, then we have to assess. So we have to, third step, we have to establish mutually agreed upon goals and objectives. So first we will be making a rapport. Secondly, we will be dealing with the problem. Then we will be assessing the problem. Then we will be mutually agreed goals and objectives we will be setting. When we are setting goals and objectives, we have to ask this question. What do you want to achieve? That is called reasoning. So we will be reasoning or assessing about the problem. How are you going to achieve it? So there comes the decision making. So choices are coming there. When we are assessing, they have choices. So based on choices, they can make objectives. So there comes the decision making. When do you want to achieve your started goal? So there comes the planning. So we will be planning based on the choices. Then what obstacles do you anticipate? So we have to, even we can make a SWOT analysis, the strength of the client, weakness of the client, opportunities of the client. So we will be making SWOT analysis. How will you address these obstacles? So again, we will be doing SWOT analysis, and with that, we will be identifying the anticipated obstacles and possible ways of solving these obstacles. Then how will you use to measure and monitor progress? So we have to reassessment, we have to maximize the resource identification. All those things will be based on this stage. So when we are making goals and objectives, we have to make this resources identification. Then we have to think whether the goals are realistic. So when we are planning itself, we have to decide whether it is goal realistic, because client only knows what are the realistic goals, because he or she only knows what is possible in his or her situations. So that is called a realistic goal. So all these things, social worker need skills, reasoning skills. So in order to help the client to reason out better, we need a proper communication, we need a proper understanding, we need motivation. So then decision making also, we need to help them to improve their skills for decision making. In planning sessions also, we can give more light on the more possibilities. Then we can help out client for doing their strength, weakness, opportunities, and threat. And we can help them to identify their resources to solve these issues. Then we can reassess whether their goals are realistic. So all these things we need skill for supporting the counseling. Then implementation, then termination, follow-up. These three things are coming in the final stage of the counseling. Reason people give for not attending counseling. So when we are thinking skills for counselor, we have to understand some people not attending counseling because some stigmas. So these are some major stigmas. Having counseling is a sign of weakness. Some people will thinking, if I go for counseling, others will think that I am weak. So based on that, they may not go for counseling. Some people is crazy people. I am not crazy. So people think that crazy people is going for counseling. I am not crazy. So I was telling you about the person who came for counseling because of issues related to his drinking. So he was thinking, I am not crazy. Crazy people only going for counseling. So in order to understand themselves, we have to support them. Then people will end up finding out I am having counseling. So other people may come to know. So that may be the reason. Then I wouldn't know what to say, talk about. Some people will think that when I go for counseling, what I will speak, what I have to say, I don't know. So because of that confusion, they may be hesitant to go for counseling. Then some people may say that I can. So one example is that one person had family issues. So family members told he can go for counseling. Then he was hesitant to go counseling. He was saying that I don't want to go to counselor. I can speak to my friends. So speaking to friend is in a way helpful, but professional help is always helpful to understand more better choices. Then I don't know how just talking to a complete stranger could help. So some people may think that how when we are speaking to a stranger as a counselor, how he can help me out. So that may be the one reason. So these are the some points. Then talking about my problems will just make it worse. So they were telling that if I start to speak, then problem will be more worse. What if my professional indemnity insurers find out? So some professional problem they will be not going. Stigmas in getting help in emotional problems. So there are these are some stigmas related to the people not going for counseling. Then factors that contribute to a positive outcome. So we were speaking about skills. So these are important point because when we want to bring out positive outcome in our counseling session, these things are important. First one is support. We have to provide assurance, empathy, trust, and catharsis. So these are the some ways of supporting the client. When they are getting the support like this, assurance, empathy, trust, then they are able to channelize their emotions. They will open up more. When they are getting more support, they will open up completely. Then we will be able to assess the problem. We will be able to find out the choices. So support is one of the important. So we have to develop a skill for supporting them to make them assure about confidentiality, assure them about our support, assure them about our empathetic approach, assure them our trust, all those things. Then facilitation of learning. So that is one of the another important thing. We have to help them to learn themselves. So ma'am was telling in the presidential address, helping them to help themselves. So we have to help them to learn what they are, what is going on. So some people may have cognitive need of learning. Some may be having feelings. So all those things we have to support. Then action. So how they have to set the goal, how they have to, including behavior regulation, cognitive mastery. So for all these things, they need action. So we have to support them with actions. Then reflective practice, support by supervision. So we have to support them in that counseling. So these are the another three things influencing change in a client. When we are making rapport, we have to give more importance for these three factors. One is readiness. When we are able to make a good rapport and the client is able to, client is ready to open, then we will get more result. So for that, we have to make them motivated. We have to make them motivated. Then second thing is that reluctance. We know when people are reluctant, we cannot understand the real reason, real problem. So reluctance we have to remove. So generally seen in those clients who are referred for help by third party. So I told you earlier, some family members will be forcing them to attend counseling. So in that people, initial stage there will be reluctance. Then resistance, generally seen in those clients who are forced into counseling. So reluctance and resistance forced by other people only. So when they are ready, they will be able to open up. So some micro skills for the counselor continues. We have to accept the clients they are. We have studied in our theory. We have to accept the person as he is or she is. Then every counselor must give more stress on listening. We have to listen carefully. What your client says, how they say that these things are important. They may be saying, from that we cannot understand everything properly, but we have to understand how they are saying it. So notice the tone of the voice. We have to understand whether they are angry saying, or whether they are sad in their voice, whether they are confident in their voice, or just casual talk. So from that tone we can understand. So for that we need proper listening. We have to listen their facial expression, gesture. So here comes the problem in current scenario, because current scenario it is difficult for us to understand, listen their facial expression. Sometimes in mobile we cannot understand their tone of voice. So in that case, we need more questioning skill, or questioning in the sense we have to do more assessment to understand proper problem. So in normal case, sometimes we need only one session to understand the problem. In teleconferencing or psychosocial support, we need more patience, more time to understand the problems. So keep silent sometimes. Give your client to think, ask questions. So we sometimes you have to pause so that they may be able to think and they may be able to ask questions to us. Then we should be sit comfortably. So these are we have to understand as a skill in counselor. Look directly into the client. So we have always we have to feel them that we are listening. So we have to look at them. We have to they are sometimes some people will be looking in the mobile during their counseling. That should not be done. So these are telling not on your papers, not on the windows, not on your mobiles. Ensure that you are continually involved in the conversation by either nodding head, saying then or oh. So these are some examples. You can do show your heads, or you can make a response. So solar, we know solar face of the client squarely. So these are the some tips for remembering how we can remember this listening. So face of the client squarely. So squarely we have to face the client. We have to listen them. We have to observe them. We have to focus on them. That is called squarely. Then adapt an open posture. Always they should feel that we are listening them, we are keen on them, we are giving attention to them. So open posture should be there. Then lean towards the other. That is one of the best people used to say. We have to lean towards them. Then they will feel that yeah, that counselor is listening. The counselor is interested in them. Then maintain a good eye contact. Always we have to have a good eye contact. Then always sit in a relaxed mode so that they also feel relaxed. So till now we were telling about different skills. So these are the skills we have to develop in basic counseling. So first one is attending. We should have a good skill for attending all the possible way. That was we were discussing all those slides. Then reflecting and paraphrasing. So when we are listening, we will understand the problem. In order to make them clear, we have to reflecting and paraphrasing so that they will be understand what we have understand about them. So that is called a mutual understanding. So they will feel when we are reflecting, when we are paraphrasing, the counselor will say whether it is true or wrong, whether it is misunderstood. So we can understand the real problem. Summarizing also one of the technique. Then asking questions. So reflecting, paraphrasing questions. These are the one of the important skill we need in current scenario, because current scenario in order to understand in better way, we have to ask paraphrasing, we have to ask question. So that is very important. Then focusing, we have to always focus on client's problem, not other thing. Then immediacy, they should feel that we have immediacy. Then rapport building, that already we have seen. Silence is important. So why counseling skills? So we were speaking about skills. So when we are having listening skill, what happens? The client can develop his her thinking. When we are listening without disturbing their speech, without discussing or disturbing their flow of talking, then they will have more thinking. That thinking will bring them light about their real issues. Then not judge. So when we are not judging, feel safe and respected. So they will be feel safe and they'll be respecting us. If we are judging, they will not open up. Then pay attention. When we are giving attention, know you care. They will understand that we are caring them. Then they will feel more confidentiality. They will feel more good relationship. Then they will, based on that rapport, they will be opening up more. Then accept the client's feelings. When we are accepting the client's feeling as they are, she is not being judged. They will feel that we are not judging them. When we are thinking about the client, get the best help possible. So when we are focusing them, we will make them more help for them. Then when we are asking question, we are developing their thinking. So that is one of the important skill we need in right current scenario. We have to ask more question in order to make them think more, because in face-to-face counseling we will be sitting face-to-face. When they are speaking, we can observe their body language, and we can see their emotions, everything. But in teleconferencing and this situation, sometimes we may not have face-to-face counseling, then it is difficult. When we are summarizing, here his thoughts and knows, already I have told you, when we are summarizing, they will understand whether we understanding them properly or whether we are not able to understand. So summarizing is important for better communication and better understanding the problem of the counselee. So we have seen rapport building, we have seen active listening. Listening is capturing and understanding the verbal and non-verbal information communicated by the client. So counselors should develop their ability to remember what was said, as well as clarity what was said or finding out what was not said. So when we are summarizing, when we are paraphrasing, there will be a proper understanding, there will be a proper communication. So both party will be understanding whether both are understanding properly. Empathy. So empathy is one of the important skill need for a counselor. So non-verbal and non-verbal attending is empathy. Paraphrasing content of client communication. So we will be expressing our empathy through these things: non-verbal and verbal attending, paraphrasing content of client communication, reflecting patient's feeling and implicit messages, attending. All those things we will be showing our empathy. We will not showing any sympathy, we will be showing empathy. So paraphrasing we have seen, listening and recall, identify content part of the message, rephrase. Perception check is usually in the form of brief questions. So this will be some steps in effective paraphrasing. Then we will be doing reflection about the client's feeling. So we were telling during these counseling sessions, we will be listening them. When we are listening, when we are observing, we will be doing reflection upon the problem. Then client's feeling will be, we will be summarizing, paraphrasing, so that client will understand whether he is empathetically attended by the counselor. Then we have to have genuineness, unconditional positive regard. So unconditional positive regard is an expression of caring and nurturance as well as acceptance. So we have to respect them for this unconditional positive regard. Then concreteness. When we are communicating, we have to make them concretely. We have to tell them the problem, solution, choices, all those things. So this is concreteness. Assisting client to identify and work on a specific problem from the various ones presented. Reminding the client of the task and re-describing. So this is same thing only we are telling. Then open questions. We have to always ask open question, not closed-ended question. Sometimes some counselors will be doing self-disclosure. So we have to think, and that is one of the important thing we have to understand, whether we need self-disclosure. So some people will often do, but we shall not do often. If it is necessary and it has got some influence or supportive for client's problem, then we can have some self-disclosure, only for motivation. Interpretation we have seen. So information giving. So one of the assessment will be information giving. So we will be removing obstacles to change. We will be giving information about what are the obstacles and how we can change the obstacles in client's problem. Supplying data, opinion, facts, resources or answers to question. Explore with clients possible problems which may delay or prevent their change process. So these are information giving. So in current scenario, what are the problems experienced in our life situations? One first thing was uncertainty about what might happen next to one's life and health. So in March when Corona started, everyone was affected this problem because when lockdown is given by government, people were not certain about what will happen next to their life, what will happen to their health. So uncertainty, that will make worries, that will make stress, that will make anxiety. So we have to work on that. Some main problems during this corona situation, people are coming for these problems in order to remove their fear, in order to remove their anxiety, in order to remove their stressful life. So we have to give proper counseling. The exponential curve of virus confirmed cases and death in the nations are reported in the media. So when newspaper, this much death is there, this much positive case is there, then people will be worried, people will be feared, people will have anxiety. So another issue. Then no, no access or difficulty in accessing health benefit. Financial constraints. One of the problem in current scenario people facing is financial problem. Many people do not have job. Many people do not have savings. Then these people will be finding difficult for their daily financial needs. Stress-based responses may be worsened among those who lack resources such as social support. In some places, social support is not there. Then they will have more stress. So symptoms and stressors. So in current scenario, the counselor should understand the symptoms and stressors are fear of infection. So many people are feared about whether it will be affect them. If affected, will they die? If affected, will society will abandon them or avoid them? So all those fear of infection is there. Then second thing is that frustration and boredom. So through frustration and boredom, even school there is no class, so students are frustrated and they are bored in their home. So their behavior will be problem. So many problems related to the children are coming because of this frustration and boredom. So when we are giving counseling for the students and family members, we know earlier, early morning students will go to school, evening only they will come back. So for parents there was no issues. Nowadays 24 into 7 students are there in their home, so they will make all kind of misuse, especially when they are frustrated and they are bored because they cannot go out and they cannot go for some movies or park. Because of that there will be boredom, so they will be having all kind of physical, emotional and psychological frustrations and so on. Then inadequate supplies, as I was telling that economic issues there. Then we know some foodstuffs are not available for some people. Then this will be affecting people physically and economically. Then inadequate information. So these are the stresses for people. So a counselor should understand these are some of the stresses. So when we will be able to understand these stresses, we will be learn why it is happening, how we can have the solutions. So we should learn these things. Then hopelessness, stigma, already we have seen. So we can have this positive psychology. So beyond blue reminds people to remind themselves that this is a temporary period. So positive psychology says that it's a temporary period, it will go. So now in current day, present day, people are not that much stressed because there is a news about COVID vaccine has arrived and soon it will be started to distribute. In many places it already started. So worry was reduced. So positive psychology says we have to understand that this is temporary, it will come, it will go. Then psychosynthesis and mindfulness also helpful. Psychosynthesis practice stage distress. These are some method we can counselors can apply when client has some problems. Solution focused therapy, finding meaning. So post psychology also finding meaning in life only. Then purpose and values. Anxiety management. So information giving is one of the important thing. In current counseling session, we may not be able to give any treatment. We'll be giving only psychosocial support. In teleconference, telecounseling and corona counseling, we'll be giving psychosocial support only. We will be understanding the problem of the patient, because some people have fear, anxiety, so on. As I have said in the health definition, people have worry about their physical issues. Some people have problem with their mental health issues. Some people have social relationship issues. So we have to give. Sometimes we have to give information. In Kerala, during Corona time, lakhs of people given counseling support, uh, counseling in the sense psychosocial support. We have to understand we may not be able to give counseling support all the patients. Initially, we will be giving psychosocial support. Psychosocial support in the sense sometimes we will be giving information about the corona. So these are WHO always updating in their website about current situation of coronavirus and current medical updation about coronavirus treatment and so on. So we can, as a counselor, we can refer them these WHO sites and give them details. Even neuroscience news and research from technology network providing a short video about this one. So we can show them that also. So before concluding, I will give some do's and don'ts. One is that we already know in counseling studies, keep an open, relaxed posture when we are doing counseling. Look at the person, use culturally appropriate eye contact to support the person to feel relaxed and heard. So when we are doing counseling, these things we have to keep in mind. Clearly introduce yourself, your name and role. Maintain a calm and soft tone of voice with a moderate volume. If the person cannot see your face, try to have a photo of yourself attached onto your clothing. Then confirm that they are comfortable speaking with you. Are you comfortable speaking to me? So you can ask them whether they are comfortable. If you would like to speak to a woman, sometimes woman counselor is coming. We can ask them as a male counselor, are you comfortable or do you want a female counselor? So that is making comfort. If someone speaks different language from you, try to assess an interpreter. So sometimes we need other language counseling. In Kerala also we are doing same thing. For every language speaking people, that particular people will be giving counseling. Hindi speaking people, the person who knows Hindi will be giving counseling and psychosocial support. Malayalam, Tamil, English, and so on. So these are the do's. If maintain physical distance. So when we are giving face-to-face counseling, we have to protect ourselves and we have to protect them also. So we have to keep the COVID protocol manners. Then don't assume that the person knows who you are or what your role is in the response. Don't look away. Already we have seen. Down at the floor or at your phone. We have to look at them. We have to give them feel that we are listening them. We are interested in their helping. Don't cross your arms. We have to always have a good body language. Don't use culturally inappropriate eye contact, because like staring at the person. That's one example. Don't assume that the person knows what you look like if you are wearing personal protective equipments. Then don't assume that person is, for example, when we are wearing mask, we will be thinking that they don't know who I am. So that we have to avoid. Don't assume that the person is comfortable speaking to you. We cannot judge they are comfortable. We have to make them assure that they are comfortable. If they are not comfortable, we have to make them comfort in possible way. Don't assume that the person speaks the same language as you. So we have to make sure that they are able to follow my language. If not able to follow, we have to find out the alternative. Then COVID protocol. Don't shout or speak very quickly. So in current scenario, social workers are giving basically psychosocial support, and for example, suicidal tendencies are dealing. Then stress, anxiety like issues are dealing. Then some people have fear, some people have ignorance. So in all those things, they are supporting. In Kerala also we are doing paid service, voluntary service, and face-to-face service. So recently we have started face-to-face service. Before that we were giving telecounseling only. So over telephone only. So I want to share some counseling a social worker can do. So in Kerala we have FLTs. So in FLTs, there will be a social work training. So normally they will be attending telephones. So some of my students has experienced telecounseling experience in FLTs, first line treatment centers. So they were sharing me that. Okay. So they were sharing me their experience. Initially, when they started to give counseling, when they started to give counseling, people were angry, worried, and they were angry with them. They were shouting at them. But gradually, when they started to attend the different phone calls, they were able to understand the situation of that person, and they had patience. They had effective listening. So initial stages, students were not able to follow the stress, and when people getting angry, they were also felt some emotional imbalance. So in FLTCs, counseling is giving. In FLTCs also, they are giving COVID positive people, their status, their report. So they will be giving like pre-counseling, post-counseling. Also, they are giving before getting the result of their COVID positive result. They will be equipping them with the counseling, and after they are getting negative result, also they are giving how they have to face society, how they have to face the behavior of the society. So they are giving counseling. So these are the some major counseling giving. Then normally in each district they will be getting phone call. There will be a team according to the need of the person. They will be giving to counselors. Sometimes they need information. In some cases, people have suicidal tendency. Then we will be doing follow-up sessions. Sometimes once in a 3 days, or sometimes once in a 5 days. If problem is worse, they will be doing regular everyday follow-up. Will be doing for people having suicidal tendencies. So based on the need, we will be referred to other persons. Initial stage, social worker students will be doing. They will be attending the sessions. Attending the calls, and they will be giving to other people. So these are the skills we need for counseling. And current scenario, we need more listening skill, we need more questioning skill, we need more patience, we need more understanding about the situation scenario, how things are happening, what is going on, and we have to understand and we have to console them. So these are the skills in current scenario. Okay, with that, I am stopping my session. Now you can ask your queries.
Thank you, sir, for the long session. And if you have any doubt or clarification, please ask in the chat box. Thank you.
Sangeetha, with your permission, can I appreciate Dr. Vinay for his wonderful presentation? Sangeetha,
Yes, ma'am.
with your permission, can I just appreciate Dr. Vinay for his
Please,
wonderful.
ma'am. Of course. Please, ma'am.
Yeah. Good afternoon, everybody. I'm much happy to see Dr. Vinayraj be a very good, resourceful person. And I know he's already that because when he was doing his research, he gives the room a lot of information on all areas, and we will have a wonderful discussion. And Dr. Vinay, you did a very good job. You spoke from your experience, And I know you have been working with the floods and with this pandemic time also. So my hearty congratulations and appreciations to you. Keep going. Thank you so much.
Thank you, ma'am. Thank you so much. Your good words.
Hello. Hello, sir.
Yes.
Yes.
Hello. Sir,
Yeah.
what is the difference between empathy and sympathy, sir?
Okay.
Sir, hello. Can you hear me?
Yeah.
Yes.
Yeah. So,
Uh,
empathy is a professional way of dealing with the client. Sympathy is a humanistic approach. So, see, when a person is met with an accident,
yes.
we will say, oh my God, he has met with accident, he will be having pain. So we will be, that's called a sympathy. When
Yes.
we are a professional, what we'll be doing, we'll be acting there. We will understand if that person is. We have to immediately reach to the hospital, and he need more support for his treatment. So that's called an empathetic approach.
Yes.
Yeah, in counseling, we are not supposed to do sympathy. Sympathy means in the sense that for example, when a person has lost some of family members, then normal people will be doing sympathy. Sympathy means they will be feeling, oh, his so and so died and so, but they will not go to that person. But empathy means we have to understand how he will be. Yeah, yeah, how he will be
Yes, sir.
feeling. Yeah, how he will be feeling now. How we can help out that person to come out from that emotional issues, and how he can face that issues by himself or herself. So helping that person is empathy.
Yes, sir. Thank you, sir.
I think he clarify your doubt. If anyone have a other doubt, please ask. Free to ask. I think his class
Yeah.
was so perfect, so that so
So
no one have
yeah.
any doubt.
So before stopping the session, I would like to thank everyone, especially
So,
Dr.
sir,
Jarada and Dr. Nirmala. Hello.
Excuse me,
Yeah,
sir.
Doctor. Yeah.
Someone asking. Yes.
so sir, congratulations, sir. I am Jamil, student from DIST. Sir, can I ask a doubt to you, sir?
Sure, sure, Father. Why not? You can.
Yeah. Yeah, while facing all these problems,
Yeah.
especially ma'am, first let me congratulate you for your well prepared and well delivered class that you have given to us, and thank you very much. Uh, the question that I have
Yeah.
is, when we face a person for
Okay.
his counseling or her counseling, when he or she comes to us with some certain problems that the client has his own mental problem affected with the environmental problem, especially the flood or the pandemic that we are facing now. Some
Okay.
people are kept away from the society because of the COVID affected situations.
Okay.
While kept away from these stages, this client may have a suicidal tendency.
Okay.
While remaining in quarantine, how
Okay.
can we make that person to overcome such a tendency?
Yeah, it's a really a good question. Normally in Kerala, we have different districts. So when some cases is coming to that center, they will be one first person will be attending the call, And as you said, they will be understanding whether it is a physical problem, whether it is fear, whether it's anxiety, or whether they have suicidal tendency. Already I have told it. So based on the problem of the client, or based on the uh, we will be understand the seriousness. For example, if it is a suicidal tendency, then we will be referring to the psychiatrist. So we will be referring to psychiatrist, and psychiatrist will be giving needed treatment. And so, as you have said, it's another question when it is a treatment. Even though it is a treatment, quarantine, or whether it is isolated, then they have, whether they have suicide tendency, we will be contacting them regularly. I have told you, if they have severe issues, they will be contacting regularly. If it is not that much serious, you will be doing once in a 3 day or once in a 5 day. And when we are psychiatrists feeling it is more severe, then they will be admitted in hospital also.
Okay, thank you, sir. Thank you
Yeah.
for your kind information. Thank you.
Sir,
Yeah,
please
please.
continue.
Yeah. So actually, Corona is a different aspect because we are unexperienced and unexpected event. But flood and all those things regularly happen in many part of India, even in Kerala also. So people know how to react to those situations. But Corona is entirely different. So in that situation, as father was asking, the problem is that this is when people do not have good immunization, sorry, immunity power, then they will be affected with the different other sicknesses, and there is a possibility for even death also. That is why people frightened about this corona in initial stages. Now, but current scenario, we know people have more knowledge. People considering this as a simple fever, because when a person is affected positive, after 5 days, if another issues are not there, they will be tested as a COVID negative. Only thing is that they will have some social stigma. So in this situation, we have to adapt our skills different way. For example, as father was asking, counseling normally we will be doing face to face. Or a person having mental issues, they will be directly coming to the hospital. But current scenario, everything is restricted. But even though it is restricted also, based on the need of the person, every medical system is supporting. So life is important. We are a medical team, and government is trying out to save the life of the person. So for that only we had a lockdown, and now reopen of 5 phases. In counseling also same way. Earlier we were doing only telephone counseling only. Like it is not, we cannot say counseling, because counseling in the sense, as father was telling, we have to go to the person. So we were giving psychosocial support for the need. If it is support, we'll be giving psycho support. If it is social
Sir,
support, we'll
your
yeah.
voice is not clear, sir. Hello?
Oh, yeah, maybe range
Hello,
is
sir.
yeah. Okay, range issue maybe. Okay, range issue. So anyway, I am winding up. So once again, I thank you.
Sir,
Yeah, hello. Yeah, thank you so much for giving me this opportunity. I am very much thankful for Bharathidas University Social Work Department, especially Sangeetha, Dr. Nirmala, Dr. Jerida, and all other faculties. Thank you.
Thank you, sir. Thank you for your valuable words. I think we have to conclude our session. And first of all, I want to thank Dr. Mangleshwaran sir, Ilanko sir, Jerida ma'am, Nirmala ma'am, Rajavel sir, Suresh sir, Karthik sir, and Selvamani sir for their immense support and advices. And thank you for my friends for helping me for conducting the session. And thank you so much for the all participants who were always with the last minute for this session. And thank you so much. And